Welcome to Evergreen Research channel. Today I am going to discuss with you about newborn reflex. Newborn reflex is one of the part of neurological assessment. It is assessed during the period of early neonatal life. Let us see the aim of doing this newborn reflex. First one is to determine the level of neurological maturation. Second one is to find out any abnormal reflex of baby due to neurological problem. Let us see the various sites of reflex and when it will disappear. First one is the reflex on eye, that is blinking reflex, that is present throughout the life, and the doll's eye reflex, it is disappear within 3 to 4 months. Then reflex of the nose, that is gaballar reflex, it is permanent one. Then reflex of the mouth, that is routine reflex, it is disappear in 3 to 4 months. Sucking reflex persists until the infancy period. Then extrusion reflex, it will disappear around the 4th month of life. Then reflexes in the extremities, that is palmar reflex, it will disappear in 3 months. Plantar reflex disappear in 9th month, and the Babinski reflex disappear in 1 year. Then reflexes of the body mass. Moro reflex, it is disappear in 3 to 4 months. Stator reflex, it will disappear in 3 to 4 months, and the tonic neck reflex, it will disappear in 3 to 4 months. See the reflexes in detail. First we can see the reflexes, that is routine reflex. When we stroke the cheek towards the mouth, baby will turn the head on the stimulated side. You can see in this picture, it clearly shows how the baby turned towards the head towards the stimuli. Okay, this helps the baby to find the breast or bottle to start feeding. Next, we can see the sucking reflex. Keep the examiner finger inside of the mouth or touch the roof of the mouth. Baby start to suck the fingers. So you can see this picture. So this reflex does not start until the 32nd weeks of pregnancy and not fully develop until 36 week of gestation. So those baby born with preterm have poor sucking reflex. Let us see the next reflex, that is extrusion reflex. So when the tongue is touched or depressed, the neonate is resisted by forcing it out of mouth. This is called extrusion reflex. Let us see the grasping reflex. It has two aspects, palmar grasp reflex and the plantar grasp reflex. What is palmar reflex? While keep the examiner finger on the base of the finger, baby start to grasp the fingers. It is called palmar grasp. Then plantar grasp, similarly, the keeping the fingers in the base of the toes, baby flex the toes and grasp the fingers. Okay, let us see the glabellar reflex. Here, tapping on the bridge of the nose, that is in the glabellar region. When the baby will close the eye immediately, that is called glabellar reflex. Then we can see the doll's eye reflex. You can see the picture, it clearly shows the doll's eyes. When the head is moved towards right or left side, eye lag behind and do not adjust to the new position immediately. That is called doll's eye reflex. Let us see the blinking reflex. When the baby is touched or shows some bright light towards their eye, the baby started to blink their eye. That is called blinking reflex. Let us see the tonic neck reflex. Placing the neonate in supine position and turn the head to one side, the arm of the turned side extended and the opposite side bent at the elbow. You can see this picture clearly, this tonic neck reflex. Let us see the Moro reflex. The baby held in examiner hand with a semi-upright position, suddenly lower the head and body in a dropping motion. The response of this Moro reflex is abduction and extension followed by adduction and flexion. This is the response you are getting out of this motor reflex. Let us see the statal reflex. When you create loud noise by clapping hands, the response of the baby for this stimuli is occur by adduction of arms with flexion of elbow joint. Hands remain clenched. We can see the Babinski reflex. Here, stroking outer sole of foot upward from heel across the ball of foot cause toes to hyperextend. Till now we have seen various reflexes with the picture. I hope this video will be helpful for you. Thank you for watching.
Please like, share and subscribe.